And I'm Susan Lentz from St. Matthew's Church and from Southern Sudan Missions.
I'm Melissa Burton, and I'm from St. Matthew's Church.
And everyone knows who I am. But we did ship some medicines, was it a couple months back now?
A few months ago. We've sent it twice.
Have we done it twice?
Yeah, December and February.
Okay. So February is a blur because of the whole Haiti earthquake, but we sent the medicines to Sudan, and so...
Yeah, we had we got them in Juba, and then we had to get them to Awil, which means
and
they had to go on another airplane.
For people that don't know exactly the geography of Sudan, where were you going in Sudan?
Towards the north and towards the west. So the county, Northern Bahr Ghazal?
Northern Bahr el Ghazal. Yeah, and Juba's down at the south, kind of toward where Kenya is, and then you go up to the north and west to where Awil is, and
it's actually
the state of Bahr el Ghazal.
Below and to the right of Darfur. So.
And tell me again your background, because you have a very interesting background.
I was a research scientist in infectious diseases. I have an MPH from Berkeley in that field, and I did lab research in virology for a number of years, and then I did an MBA, and then I've done some work, clinic work. I worked at the Haight-Ashbury Free Clinic's HIV program as a volunteer for a while, and then mostly I've been out of the clinic, but I did a lot of lab work, and I've done a lot of medical research, and I've done about 10 years worth of kind of marketing and strategy consulting for the pharmaceutical industry. So in oncology, and I did 4 years. I worked on vaccine projects. So
parasites are a huge problem around the world that I think most people don't realize. And you saw a lot of parasites in Sudan. How many people had parasites?
Well, it depends on what you define as a parasite. If you want to talk about, worms and amoebas, probably about 40 to 50, well, of the people that came to the clinic, because first of all, you don't know, of the people that came to the clinic, you don't know if that's 10% of the population that's sick or half, right? So of the people that came to the clinic, more than half of them had worms. Or we were giving them the mebendazole that you all shipped, and the package insert didn't arrive with this. Apparently, your package insert said use 10 pills, whereas the Oxford Tropical Medicine Handbook said use 1, and so the local guys were using 10 based on the advice from because there's a little bit of drug resistance going on. It turned out using the 1 mebendazole pill wasn't doing it for most people, which I found out. I was doing that based on what was in the Tropical Medicine Handbook, but you guys were actually right with your package insert, and they used 10, and he said, people were definitely getting rid of their worms, so I tried to find out what kind of worm they were, because the other thing is there's no lab tests, there's no clinic, there's no running water, there's no electricity, there's no doctors, you can't run tests. They had nothing, so guessing what kind of worm people had is okay. Your worms are coming out? Okay, what, and you're talking to somebody who doesn't speak English, so what shape? Are they square, or are they this shape? So I was drawing different shapes of worms, and then I say, they're that one. I said, okay, probably ascariasis, and so that's treatable with the mebendazole, but the guinea worms, which I unfortunately saw in that one village, are not.
And tell people what a guinea worm is.
Okay, these are dracunculiasis worms. They're about 2 to 3 feet long.
Wow.
I didn't actually see the worm, but I saw pretty strong evidence of people that were hosts, and there's really not much else out there like it. Most of the other worms are small, right? They're either tapeworms and they break off pieces, but these worms actually, go punch through your flesh. Like tapeworms stay in your intestines, but these, come out of the body. You eat you can swallow the eggs, and then the female worm will start, multiplying, but they become very large, and then they eventually leave your body. So they're kind of horrifying, really. And do you want to hear about the
the little boy with
Yeah,
okay, so
it's reality.
Or the woman that was
I'll tell
pregnant?
all three worm stories. Okay, so in this village, I'm sitting under a tree with the medicine in front of me, and the worst thing is we didn't have the medicine for those worms, which I know what it is, but it wasn't the mebendazole because the worms are too big and the mebendazole will kill them. Okay, so and even so, I was sitting under this tree, and this there was a little boy and a woman and another woman, and the first woman showed me this scar on her chest. It was a big keloid, about this big, and I said, oh, I said, what's the problem? She said, well, I can feel my heart beating underneath this scar. And I said, well, why do you have a hole in your, what happened? I thought maybe she, had an accident with a machete or something,
This is speaking through translators too, right?
Speaking through translators, yeah, whose English wasn't perfect, so.
You do the best you can.
It was all about that, yeah.
Mm-hmm.
So she said, well, that's where the worm came out, and I said, great. And so she's saying, oh, the worm comes up my esophagus, and when I want to eat, it grabs the food and comes down. And I said,
wow.
Oh God, they've got the guinea worms here, and so and then they're talking about feeling things moving around in their body, and so I said, the worm pills don't treat that. So I said, what you need is when it comes out, you have to catch it, because this is what they do in Africa where they have these, and you have to very slowly wind it out on a piece of. So I told her how to do that. They didn't know that there.
So you did a lot of education.
Well, they didn't know this. I mean, some of the places in West Africa, they know about that. But I said, you have to, put it on a pen and, wind it out really slowly. And so.
How strong are these worms?
They're pretty strong because they're big. So the usual treatment is, the metronidazole is, to reduce the inflammation and painkillers, and then you try to take the worm out. So that's what's in its book.
Okay.
So the next patient was a little 12-year-old boy, and he was, I said, what's troubling you? And he said, well, my chest hurts because the air comes in when I'm breathing. And I'm like, okay, so you have a hole in your chest?
Yeah.
From the worm.
From the worm.
So I said, he has one of those worms too, and we didn't have the medicine for those worms. So that was, the TB was another problem, and people are coughing up blood right in front of me. Have had some kind of bad cough for 5-6 years. When people get to the point where they're coughing up blood with TB, that usually means they're on their way out. So these are spread by fecal-oral transmission, which means clean water. So people were coming to me. The other thing that people were getting a lot of was fungal infections, really heavy fungal infections. I saw this little girl whose skin was just completely all up and down her legs, covered with crusty scabs, like a 3-year-old girl. And there's the water that they're people are making bricks out of. They have the rivers, and then so there's rivers. It's this sort of a plain, marshy plains, drier plains with lots of river. They're tributaries of the Nile, so there's all these different little rivers running around. And then they have a wet season and a dry season. So the dry season, it's dry. And they kind of move around depending on, historically they've been kind of semi-nomadic, and they'll move seasonally based on where the water is and where their cows can eat. So in the wet season, I think people, are in mud. There's a lot of mud. And the water is not clean. River water, the rivers have schistosomiasis. There's parasites in the river water.
So they're drinking dirty water.
They're drinking dirty
Some
water.
of them are
They're
shoes.
walking around in dirty water, and
Using it for cooking and for making the bricks and.
yeah, I mean the people with the fungal infections, it seemed like they were wading around in mud a lot because they make bricks for a living, or
So if they had boots, would that no?
Yeah, if they had boots, but it's also 100 degrees.
It's really hot and really humid.
It's roasting hot there. Yeah, and so if they had, this other village, everybody had less scary worms. I mean, they were still pretty nasty worms, but they weren't those really terrible worms. There were ascariasis and pinworms, and
so much healthcare needs around the world.
There are.
Yeah.
I mean, this is basic.
It's a
What?
very,
They're
their
just
needs are very
basic-
basic, and they're
basic
so
needs.
important, but they're really basic ones. And I think they're so basic that we don't, in Western countries, we don't appreciate the needs that they have, because it just is out of our realm of comprehension, because it just,
Right.
I'm nice to know, so one of the patients had been suffering from a bladder infection for 4 years. Because bladder infection,
These are things we know what
that
to
are
do.
easy to take care of.
you need, she could have been treated with antibiotics.